I didn't tell you.
What's so?
My own.
Okay. Good afternoon, my lecturers and my fellow students. Standing here is Olumide Nicholas, and with me to present a topic on seizure and epilepsy. This next slide. Right. Seizure is a brain disorder or disease where nerve cells do not signal properly, which causes seizure and loss of consciousness. Seizure are uncontrolled bursts of electrical activities that changes situations, behavior, awareness, and muscle movement. Epilepsy is also called seizure disorder. One of the physical signs we see in seizure is convulsion, which involve involuntary muscular contraction. Please, next slide. Alright, let's look at the types of epilepsy. We have 4 categories of epilepsy. We have the localized epilepsy, we have the generalized epilepsy, we have the combined localized and generalized epilepsy seizure, and the focal impaired awareness seizure. Now, with focal awareness seizure, the patient remains like the person is aware of what is going on, even if the person doesn't recognize it as a seizure. While in focal impaired awareness seizure, one may not be able to hear, talk, or do as the person did before. Next slide. Alright, so this is the image that illustrates that. Next slide. Generalized epilepsy, just as the name occurs, this one occurs at all parts of the brain. We have subdivisions here. We have the grand mal seizure, we have the petit mal seizure, and we have the psychomotor seizure. Now, in grand mal seizure, there is sudden, there is unconsciousness, loss of consciousness, there is convulsion, and the person have a warning sensation. Here we have 2 stages. We have the tonic stage and we have the clonic stage. Now, in tonic stage, there is contraction leading to spasm. What this spasm does now, it causes the flexion of the limb, flexion of the upper limb and the extension of the lower limb. While in clonic stage, there is the violent jerky movement. Here, there is repetitive of that movement. Next slide, please. Now, next slide. Just at the repetitive form, this one now has to do with there's unconsciousness, there is no warning sign. Here, convulsion do not occur. It lasts 3 to 30 seconds. Next slide. Next slide. This is psychomotor seizure. It is characterized by emotional outbursts such as sudden anxiety, fear, or discomfort. Now, in this seizure now, a person with this seizure can attack another person boldly or rub their face vigorously. One may not be aware. Those who are aware cannot just stop it because it involves an involuntary. It is made up of 2 seizures. Now, your signs and symptoms is to here depend on the kind of seizure that you have. So it's when generalized and localized are being combined. Unknown onset seizure. For instance, you're sleeping with your partner at night, wake up and you find the person having this seizure attack. So since there's no medical reason to back up what triggers this seizure, we now call it unknown onset seizure. Next slide. Alright, now let's look at the syndromes of epilepsy. Most of these syndromes occurs at childhood. So some of the syndromes we have here are the Dravet syndrome, we have the childhood absence syndrome, the Benjamin familial neonatal syndromes, and others. Next slide. Next slide.
The signs and symptoms of epilepsy. The symptoms that occur before seizures take place. The patient will have a sudden feeling of fear and anxiousness, dizziness, a change in vision, deja vu, which is the experience of thinking that a new situation has occurred before. Signs that indicate the seizure is in progress, making unusual sounds like grunting. Next. Causes of epilepsy, we have the genetic mutation, the mesial temporal sclerosis, the metabolic disorders, and the brain infection. Next. How to identify seizure triggers? A few of the most common triggers are lack of sleep, illness, fever, very low blood sugar, injuries, skipping meal, overreacting of specific ingredients. And a good way to identify your trigger is to have a seizure journal where you note down the day and the time, what activity were you involved in, and what was happening around you, unusual signs, right, like unusual stressor. Next slide. Effect of seizure. We have 2 effects: the short-term effect and the long-term effect. The short-term effect, the person will no longer be able to drive, to swim, or to travel alone. The long-term effect, the person will have depression, coma, or emergency. Next slide. Diagnosis of epilepsy. We have the doctor will run a blood test to check your electrolyte imbalance, a spinal tap to rule out infection, toxicology screening to test for drugs, poisons, or toxins. An electroencephalogram can help your doctor to diagnose a seizure by viewing the brain waves. Image scanning, such as computed tomography scan, magnetic resonance imaging, or position emission tomography can create a clear picture of the brain. Next slide. The treatment for epilepsy, we have the anti-seizure medication. These drugs help to suppress seizures. We have the tebretol and the topamax. Next slide. The ketogenic diet, which is also known as the Mediterranean diet. This diet is high in fat, moderate in protein, and low in carbohydrates. Next slide. We have the surgical resection, the disconnect. We can prevent epilepsy by eating healthy diet, wearing helmets when biking, wearing seatbelts when driving. Next slide. What to do if a person has a seizure? That's the first aid of epilepsy. First thing, do not panic. Then you do not move until the person is in danger. The next thing, you loose tight clothing around the neck. Then do not put anything in the person's mouth. Turn the person to the side, which is known as the recovery position. Then if the person is in a wheelchair, put the brakes on and the seatbelt on to prevent the person from falling over. Time the seizure, when it starts and when it ends. When to call an ambulance. It's time when the person's seizure has passed 5 minutes, when there are injuries. If it's the first time the person is having a seizure, and if the person has recurring seizures.
All right, next two slides, please. From abnormal electrical activities from cells in the brain. Epilepsy is a neurological disease defined by having multiple ongoing seizures. Now, in 1 to 26% in the US, another part of the country, in their lifetime shows some of these seizures. Treatment options include, we have anti-seizures medication, we have special diet, we have also surgical methods. Now, one can play a better part in managing your seizures by getting adequate amount of sleep, limit alcohol intake, eat healthy diet, avoid your seizure triggers, and take your medication exactly as rated by your healthcare provider. Please let's go back to the slide. Right, this is a 45 seconds video. I picked the audience. Let's play this, and it illustrates seizure. All right, this is a man who had a seizure. This is what happened to him. So the first thing is for you not to be frightened, because these situations can be frightening. So you just have to relax and observe what is going on. Now, as the lady turned the man, she saw that this is like placing him on a recovery phase. And this recovery phase, now you have to clear things around. You understand that you have to time the seizure and know when the seizure lasts. So that is it. Then when to call an ambulance, just as I said, if the seizure the first time, if the person have a recurring seizure, and if the person injured, that is what we call an ambulance. All right. Thank you.
This last video is very, very good. You summarized everything.
Thank you, sir.
Talk. Play that video and everything.
Thank you, sir. Thank you, sir.
Small step away the manage. You don't have to video.